Welcome, everyone, to the return of our three-part webcast series, The Public Health Insider. My name is Casey Farm, and I am the Director of Alumni Relations for the College of Public Health and Human Sciences. I am delighted to be able to introduce the moderator for today's episode. It takes a village, shared challenges, and shared solutions. This is the first webcast of the return of the Public Health Insider series. We will have our second and our third episodes on Thursdays, October 29th and November 12th, both at 1 p.m. For more information and to register for those webcasts, please visit osualum.com/public health webcasts. For more information on public health and all the other incredible work that is being done in the college, and there is quite a bit, please visit health.oregonstate.edu. Now on to today's moderator, who will introduce the topic and panelists. Our series moderator is Dr. Allison Myers, and she is the director of the OSU Center for Health Innovation in the College of Public Health and Human Sciences. Before coming to OSU in 2018, Dr. Myers served as the Health Policy Fellow to U.S. Senator Sheldon Whitehouse. She also co-founded and led CounterTools, which is a nonprofit technology startup dedicating to advancing place-based public health through citizen science, data visualization, and policy advocacy. She earned her BS in Environmental Resource Management from Penn State University and her MPH and her PhD in health behavior from the Gillings School of Global Public Health at the University of North Carolina in Chapel Hill. It is now my absolute pleasure to introduce and turn the webcast over to Dr. Allison Myers. Welcome, Dr. Myers. Thanks for being with us today.
Thanks so much, Casey. It's such a lovely introduction, and I'm so happy that we can do another episode of this webcast. As we begin, I want to acknowledge that the Corvallis campus of the Oregon State University is located within the traditional homelands of the Marys River or Ampanefu Band of Kalapuya. And following the Willamette Valley Treaty of 1855, Kalapuya people were forcibly removed to reservations in Western Oregon. Today, living descendants of these people are a part of the Confederated Tribes of Grand Ronde Community of Oregon and the Confederated Tribes of the Siletz Indians. I think as we do this work and as we think about public health, creating conditions for health and well-being, it's important to acknowledge the lands on which we're sitting. Again, my name is Allison Myers. I use she, her pronouns. We're thrilled that all of you are here today. I get the distinct pleasure of scrolling through the attendee list, and there are so many of you that I don't know and I haven't met, and that I think just thrills me because it means maybe we're introducing you to the work that we do here at the College of Public Health and Human Sciences at Oregon State. I want to encourage my panelists. I'm going to talk for maybe a minute, and so you can start turning on your videos and things after that. But today we're talking about hope and action really in the face of adversity. And for those of you who thought, well, I'm going to tune in, I don't know, I'll multitask, maybe I'll listen. I just want to invite you to really join us. Grab a cup of tea, coffee, water, sort of show up in the space. The story that we have to tell today is one of hope in times that are really challenging. And I think it's the women that are going to be talking are amazing. And I hope that you'll just really enjoy the conversation. It very much fits with the vision of the Oregon State University College of Public Health and Human Sciences, which is lifelong health and well-being for every person, every family, every community in Oregon and beyond. And as all of you on the call know or can imagine, true health and well-being for people, for everyone across the seasons of their life doesn't just happen, right? There are lots of structural or systemic forces, for example, racism, that advantages some people, disadvantages others. And in the words of our dear Dr. Kamara Jones, who spoke with us just a couple of weeks ago, saps the strength of the whole society through the waste of human resources. So much of our work then in public health is to create conditions for health and well-being for everyone, which we can think of as undoing those structures that sap our strength or alternatively, building bridges, building structures that give us strength as community. So without further ado, I'm going to start to introduce our panelists. Today, we're telling a story and having a conversation about responding to COVID-19 in the town of Newport, Oregon, on the Pacific Coast in Lincoln County. I'm joined by three outstanding colleagues. Oh, good, you're all there. I had to make sure I could scroll through. We have first Beatriz Boteo Salgado. Beatriz is the SNAP Ed Education Program Assistant in the Lincoln County Office of the OSU Family and Community Health Extension Service. She served as staff at the university for over 17 years and was recently awarded in 2018 the first ever Extension Director's Coin for Excellence at the Outreach and Engagement Quarterly Conversation. Beatriz is also a member of the Newport City Council. Beatriz, say hello.
Hi, everyone. Thank you for being here. And I really appreciate the invitation. And my name is Beatriz Botello, and I have been with Newport for more than 20 years. I love Newport because that's how my husband and I, we came to look for jobs at the fish company. And that's how my husband got a job. And I grew up, my three kids, they went to OSU, a couple of them. I still have a teenager. I'm very pleased to be in the community at Newport, and I will continue saying more forward, you know.
Wonderful, thank you. We also have Dusty Linnell. Dusty is a faculty member in Family and Community Health Extension at Oregon State, serving Tillamook and Lincoln counties, both on the Oregon coast. Dusty works with community organizations to translate public health and nutrition research into practice. She teaches courses, conducts applied research, and works on community projects to support food access and healthy eating, physical activity, mental health, injury prevention, and more. Say hi, Dusty.
Hi, everyone. It is such a pleasure to be here, to be able to share the stories of the work we're doing on the coast.
And finally, I want to welcome Aurelia Mendez, who is coordinator and lead instructor for our community health worker training program, housed in our college in partnership with the Center for Health Innovation and OSU Professional and Continuing Education. Aurelia is a two-time public health alumna of Oregon State. And prior to joining us last year in her current role, she worked as a health navigator, or known as a community health worker, for the Benton County Health Department. Aurelia is originally from Nissa, Oregon, out east, pardon me, in Malheur County. Say hi, Aurelia.
Hi, everyone. My name is Aurelia Mendez. I use she, her, hers, and ella pronouns. Thank you for joining us for our talk today. Gracias por acompañarnos a todos los que hablan español en esta plática de hoy. I'm also proud to say that I have three younger sisters that are also College of Public Health alumni. The youngest one is now entering her freshman year in public health too. So very proud of the college and proud OSU alumni.
Love it. Same. Just yesterday I was, it was at the Oregon Public Health Association conference where I was saying, gosh, I'm so thrilled to be a part of what we're doing. So with that, let's talk about what we're doing. I think from my perspective, it feels like the three of you have worked together forever. And that actually is not the case. You came together earlier this year, and let's talk about the spark. What brought the three of you together?
Well, amazingly, it's only been since July that we've been working together. It's only been, 3 months? It does feel like a long time because we've been working really tirelessly to support the communities in Newport. But the event that brought us together was the COVID-19 outbreak in Newport. We knew that there were many people affected because of the outbreak at the Pacific Seafoods. And that disproportionately affected our Latino and Indigenous community members. That was coupled with the OSU Trace project, who came out to Newport to study the prevalence so that the community could have a better idea of the spread for COVID-19 in the community. And when those data came out, they showed a 3.4% prevalence, which was alarming. And so the spark was that I knew I could reach out to Beatrice, who has been working with families in the area for many years and connects with them often and could help me understand what the needs were. As an extension faculty member, I was able to bring some resources to be able to assist with many different things. And so I called Beatrice and said, where can I help? We shared many conversations about the things she was hearing that people needed, from just general information in Spanish and also in the Mum language, which is spoken by Guatemalan community members in the area, that there was a huge gap in those translated materials on some of the basic things that maybe were circulating in English for a long time, like how to wear a mask properly and where to get tested, and how to get financial assistance if you have to quarantine at home if you've been exposed to COVID-19. So we started talking to everyone we could to find out who would like to partner with us and being able to expand our outreach materials. And we also, at that point, connected with Aralia, and she joined our team. And we were so grateful because she brought a wealth of experience and was able to assist us with interpretation, and her experience as a community health worker and working with the community health worker program provided us with some amazing skills to get us moving and thinking about how we needed to support the Latino and Indigenous communities in Newport.
So Pacific Seafood, there was an outbreak of COVID-19. The researchers, some of my research colleagues from across the university, they do the trace study, they find 3.4% prevalence. You all are like, okay, let's do this. And I think about, Dusty, you're a nutritionist by training. I think that's fantastic. Beatrice, you've been working in nutrition education. Aurelia, you're training a workforce. Three dedicated folks. I know there's a larger team, so let's dig into it a little bit. Beatrice, I'm going to come to you. Tell us, for listeners in the audience, right, what do they need to know about Newport? Give us a little background on the town, and maybe tell us about your reaction when you heard about this outbreak and the prevalence of COVID-19.
Thank you, Alison. That's a good question. Newport is the fishery industry is big, and it started in 1862 when with the oysters. They find some oysters in this area, so the new people who came, they started working since then. In 1908, I want to give a little bit history of Newport. So more people starting come to work in this area from South America and Central, and also from, we have also workers from Africa, and now we have from Ukraine. So we have workers that come in stay temporary, but the immigrants from North, from Central and South, they have been here and stay usually longer. So one of the things that I want to share is that Newport has been our Hispanic and Latinx has been growing. It's about, from the last census, it's about 10% the bracket they grow from last census. I don't know, this time I probably is gonna grow even more. So I wanna say in Newport right now, there are, from the census is 16% from 2019, but I kind of had the feeling there's about 20%. If you go to a school, you can see kids probably around 30% in the schools, Latinx and Indigenous. So the predominant race is white, is 80%, and then we have the median age 45. It's about 54% females. So I know those demographics by heart because I have to follow through. And also education is about high school graduation, 92%, bachelor's, 28%. And then the health, because we are speaking of health, that's about 9% of the population in Newport, they don't have insurance, about 9%, but the Latinx is impact about 33%. That's the impact of no insurance. So, and this is from the last health assessment. Also, children who are in poverty, about 30%. That is families with children, and that is from OHP. And I want to say there's disadvantage, in our community, as Dusty mentioned, with the communication, and that's a big one, the communication, but also we have only two medical bigger providers. We have the Lincoln County Health Department and we have the Samaritan Hospital. And of course we have clinics with the Samaritan. But I wanna say when I find out about the Pacific Seafood, it has about 350 workers and they all were tested. And they have about 125 workers test positive. And families, because I have that relationship with families, they started calling me and say, I just find out that I'm, I had the COVID. I don't know what to do. I don't know where to go. I need an appointment for my kids. So what happened at that moment, that was very challenging to get an appointment because we had the barriers, language, but also not being able to go directly to the clinic, to set up an appointment. So there were several things that we want to talk more. And I was very surprised to see, and the families, some of the families, they didn't have any symptoms.
Yeah, so, I mean, to review a little for our listeners, right? You've got folks, you have a growing Latinx, Indigenous, Hispanic community, people who speak Spanish or other languages at home. A third of them don't have health insurance coverage. We're working in the seafood plant or other places where, it's not like me with, working from home with a computer. You can't do that. And I think this is a good time. I was just looking today at the COVID-19 numbers on the Oregon Health Authority dashboard, and what you all experienced in Newport, what the town of Newport experienced, is in line with what we see for Hispanic populations across the state. So as of this morning, there have been a total of about 38,000 cases of COVID-19 in the state, and 37% of them are among people who are Hispanic. There are only 13% of the whole population in Oregon that are Hispanic. So we see that huge differential. Beatriz, you were getting all of these calls because you know everyone. It's a small town. You're on the city council. You've been a part of the community for a very long time, raised your children there. You were getting lots and lots of calls. Tell us when did Dusty call? And then what were the first steps that the two of you started taking? How did you sort of launch this plan into action?
Dusty called me when, right away after the trace from OSU, right away we connect because we find the prevalence 3.4. And, I was very concerned because in my head, the first thing that I was thinking, what is the percentage of those 3.5% that are Latinos, you know? Of course, that information couldn't be relieved to us, but, you know, I just want to say it's very concerning. And one of the parts is it was you know, very vulnerable is that a lot of families, they live together. You know, in one whole household, you find 2 or 3 families, because affordable housing, that's another situation there. So, and then Dusty called me, and I got connected with her, and we started working in a plan. Dusty organized, you know, really nice meetings, and I'm gonna let Dusty to share more about it.
Yeah, we assembled a team. We had a few people kind of come together. We were joking the other day that we can't even remember exactly how everyone joined our team, but the first partners were the Lincoln County Health and Human Services, because we knew we wanted to help support their outreach efforts. And then we also were connected with an OHP assister, Alex Umakinga, who's been a really core person on our team, who is employed with Olala Center, which is a nonprofit in the Newport area, and a few other people who were eager to contribute. And what we started thinking about was, how do we help get more information out to help people with the information they needed? And I drew upon some of my experience with health education research. And many studies have shown that people trust 2 primary sources when it comes to health information: their doctors and their friends and family. And so we looked at the landscape of Newport and, like, where was the information coming from, and how could we help amplify that? And so there was great information coming from Lincoln County. There was information coming from the Samaritan system. And we thought, well, let's start thinking about how we get friends and family to share messages. So one of the first actions we did was to create a YouTube channel, and it's called Novedades del Condado de Lincoln. And the idea was to see if we could find community members who would be able to, you know, use our scripts that we developed in partnership with Lincoln County Public Health, and be able to talk to their friends and family through videos, and just selfie videos. You know, I think lots of people were concerned that we weren't going to be putting these high production videos together, but we really wanted them to spread quickly, like they do on social media. And we know that people were communicating via Facebook and WhatsApp and other social media applications. So we worked with a variety of people to get those together. And we also developed them in Mom, because we know that our Guatemalan community, they don't use a written language. So we wanted to make sure we could have communications go out in a way that they could get the information they needed. So it was a whirlwind of getting people together and connecting with OHA, making sure our messages were correct, being able to connect with people who are interpreters to make sure that the information was correct. We had lots of discussions about things like the proper terminology for face masks, where we finally settled on cubrebocas as the terminology that was consistent with others. But it really matters when we're interpreting for different communities how it's going to be accepted and what is the terminology they're using. So, so that was the first work that we did together.
Can you humor us a little and tell us about some of the mistakes you made, or maybe some of the earlier names for face mask that didn't quite work? Maybe,
yeah,
I don't know who wants to take that question.
Yeah, Beatriz or Oralia, you could probably help with this.
I think, yeah, some of them were like, we were trying to use direct translation, which doesn't always work with the Spanish language. So máscaras was one, and we're like, well, that's kind of, you know, it's long and there's a lot of syllables. We started looking at other counties and government websites, what is being used. We saw, you know, a combination of different terms, and we just, as a group ended up deciding that probably cubrebocas was the best. We talked about for a while, we talked about, does that encompass the nose or just the mouth?
Right.
You know, the whole half of the face. That was something that was early on. We were trying to get the best information out there.
Tell us what that means for people like me who are woefully behind in their Spanish. Does that mean cover mouth? Okay. So I think that's fascinating that you choose the right term and then you teach sort of how that's meant to work. So at this point in the process, you're getting out information campaigns in relevant languages from sources that matter, I think, right? Welcome to best practice in public health and health promotion. And you're working with the Olala Center too. Does the Alex, the OHP assister, was he helping people get connected to care, like getting on OHP? Yeah, okay. So that makes me think about, the structures that we put in place to support one another and sort of making that connection for the first time. Cool, so let's keep going. I'm looking at your many process updates here in my notes. Let's fast forward to later in the summer. What was next in the story? You brought together this team, you're amplifying the messages. How are you engaging the community during these times?
Beatriz and I were trading looks, trying to decide who was going to take this on. The first thing I think was Beatriz, and she worked with the county commissioner to gather people together for a community listening session. So I think it would be fantastic if she could explain what that process looked like and our first engagement with the community.
Yes, I can share. That would be great to share this part because Katie is our commissioner here. So she started also getting, information from the call center where people, they started the call center is set up in case an emergency, the disaster, but we were in COVID. So they set up this call center and I was volunteering at the call center. So what happened, I got a phone call from one of the community members and said, I called the line to set up an appointment. They didn't understand me. They hung up on me. I never went through to get an appointment. So then I got another, I got another phone call. It was similar. And then I decided to call myself to see if that, to follow through. And I find out that they didn't have Spanish speaking, interpreters at the time. So, or I don't know what happened with the line, but anyway, I called Katie, the commissioner, and I said, hey, I'm wondering if you can help me, we have a situation here and I know the call center is through so she decided, she fixed that problem right away. And she said, why don't we do like a community meetings, And I said, yeah, because I shared with her, that the community members, they were asking a lot of questions about COVID. And I said, I'm not expert in answering all those questions, I feel like maybe we can bring the health department director, we can bring the Samaritan director. They have the latest information. So we decided to do a community meeting, like at this panel, and bring the two directors in the meeting. When we did the meeting, we had about, the first meeting, we had about 25 people join us. They had great questions right away. They start asking about COVID, the call center, the numbers, where to call for mom. So after that meeting, there was a big change because also the mom speakers, they asked for a call center and mom. So now we have a call center they can call directly to and get mom support. So it has been a very good way to address some of the situations with the Latinx and their voice. They can hear their voice better than if I try to pass the information. You know, it seems like the information go faster. So I don't know. I think we so far we had 3 meetings, and Dusty can speak more of those. And because she coordinated the last one, and she did a great mapping, and she can talk about it. It's really good.
Okay, maybe we'll come to Dusty for that. I think I love this story, and what I want to highlight is that you all gathered people who could make decisions to benefit the whole community. And they did, right? There were changes immediately at Samaritan and at, forgive me, I don't want to misspeak, but there were healthcare partners that heard very tangible changes that could be made, and they were made. And I think that created a lot of goodwill. I would like to think that created a lot of goodwill and sort of had you keep going. I want to, we're about halfway through the hour. And so I want to start to transition maybe to some bigger picture, sort of placing this work in Oregon. But before we do that, let's talk a little bit more about maybe the most recent meetings and what's coming up for you all. I think I may have heard that yeah, let's talk about the most recent meetings. I won't make anything up. So.
Yeah, as we transition from crisis response in those early days to thinking about what we were hearing with the deeper issues, the systematic issues, we as a team decided to really think about what are the things that we would need to assist the community with to build a stronger, more resilient community should another emergency come up. Unfortunately, the fires happened and Lincoln City was affected. So while we were starting to brainstorm, bigger and long-term, we got derailed a little bit to emergency response again. But now we're kind of retooling again, and we're focused on a couple of areas. One is having a robust communication system, recognizing that communication was really a big issue in COVID-19 and the fires. To be able to have support systems and infrastructure across the county, not from just a governmental perspective, but from a community perspective, and linking community members together. Another area we discovered in talking with community members and people on our team is that there's a lot of feelings of isolation as people are immigrating here and coming to the community, that they're not well connected with families or developing friendships. And so if we think about what a strong community means, that means a sense of belonging. And so we're thinking about ways to be able to enhance those things. Food security is an issue too, and getting access to cultural foods that they grew up making. And so an area of interest for us is thinking about how our SNAP Ed program is partnering with our Master Gardener program and the Small Gardens program to potentially have community gardens. And then I'm really excited, one of the most recent projects we're working on is we've brought on an amazing graduate student from the College of Public Health and Human Sciences who's working on a master's in public health in health policy and systems. And she's going to be doing more community engagement work for us to be able to help us learn through interviews, in-depth interviews with community members about what concerns them most, and then also helping to get community members connected with us, because one of our goals is to have a team that is not just agency based. We want to have a team that's community members who are all working with us and telling us where to put our resources, where do they need our help. So we're really excited to be moving forward in those areas.
Dusty, I think one of the things you and I share as faculty is that is exactly what we get to do, right? Work with people to find resources to do what needs to be done. And I hear you talking about these various strategic pieces, right? Communication and infrastructure support, knowing that in the community you need to create a sense of belonging, preventing social isolation, which we know is dangerous for our health. You've talked about food security and sort of bringing in non-traditional partners, and certainly conducting a needs assessment to go more in depth. All of these strategic pieces remind me of what I'd love Aurelia to share about next. Sort of public health modernization is it was a piece of legislation in Oregon that paved the way for thinking about public health practice in terms of having our folks be strategists, chief health strategists, rather than sort of focusing in one topic area. Nationally, folks call this public health 3.0, right? Where we're moving from just addressing to disparities to really rallying across sectors to get to root causes. And Aurelia, I am hoping maybe you could add some of the details on the coalition building and bringing in these pieces that reflect modernization, what that looks like, not just from the statute, right? Not from the requirement, but what that looks like in practice from your view as you train a new workforce.
Yeah, thank you. So there's this framework, like Allison mentioned, it's really focusing on the public health system's work to address Oregon health challenges. And really we're looking at achieving outcomes that we need new strategies and investments that meet the needs of our communities. And we also are preserving and expanding the public health protections and services for everyone in Oregon. So for specifically for our group and public health modernization, we focus on that coalition building and bringing together partners with decision-making powers, resources, and the community members that were being affected. Often, coalitions are agency centers, and we need to engage with community members to ensure that the things we implement to address the disparities experienced by the Latino and Indigenous community members align with their wants and needs. So we're not just providing, a service that they're like, wait, like that's not what we asked for. We're actually, including them. So as Beatriz and Dusty mentioned, we are inviting community members to be part of this group and this team and become leaders in the community to be able to, not only build our own capacity, but also build an effective coalition in the community. And with the workforce, the community health workers, we really try to bridge those gaps. So as, we mentioned Alex being already part of the community, engaging as an Oregon Health Plan assister. So he has those connections in the community that could really bring both the community and our group together so we can build on these efforts. Maybe some of there's 11 core foundational capabilities and programs in public health modernization. And so some of the foundational elements that we tried to cover in this group were, promote the health promotion piece with mass donations. I was able to get mass donations from the Albany group called the Linn County Mask Makers. They provided 200 adult masks and 100 child masks, which was really helpful to be able to provide to the community in Lincoln County. And of course, and then bringing, whatever we have as our efforts in this, like OSU Extension provided donations also of masks and hand sanitizers. Trying to share those videos that we developed. Really, there's just a lot that we try to address within public health modernization, and it's really like starting and kind of giving some ideas as to how we can address this.
I know you also were offering, it's been really important to your group to make sure that your meetings are held in Spanish, that the platform that you're using is accessible to folks, that you're doing a needs assessment to understand what does the evidence say, not just the numbers, right? Those are really important. You want to understand the epidemiology of disease and health promoting factors, but you also are really working hard to understand the sort of hearts and minds of the community that you're working in. Another sort of big picture topic that I want to make sure we cover, and this is the point in the talk where if you all have questions in the audience for our panelists, if you're curious about any of the topics that we've covered so far, now would be a great time to add them to the Q&A panel at the bottom of the screen. We do have a couple of questions at least that have come in advance, but if you have other thoughts, please let us know them now. I want to transition a little bit to what the future looks like, and I'm going to quote the Oregon State University Strategic Plan 4.0 that I'll make sure I read it. We very much see our leadership as a university, our leadership in health and wellness as a strength. And we have a statewide network of extension and public health partnerships that we feel really could be a model for delivering health services, public health and well-being, meeting our vision. I would love to hear from each of you, at least briefly, on, what's the future look like? What's next? What do you envision? What hope do you have for what we could do in the future? Should we start with Beatrice and then go to Aurelia and then to Dusty?
That's a great question, Allison. Thank you for making that question. One of the things, I'm a visionary person, I really, kind of in my brain, I see the future, one of the things that I want to say as an extension worker, as an extension professional, I want to say we have the tools. We have been doing in this community outreach and engagement for a long time, We know our community. Extension has been here and work in different sectors. So because we have those tools, we know how to work from community base. Instead, I know that right now, there's the movement of delivering services community based, like reaching out. Those community meetings opens an opportunity for the community to participate and ask their question directly to an expert. That's very important to the community. Another part that we have been learning is that the Latinos or indigenous that are ready to be volunteers, they haven't been part of the volunteer part, that are ready to be in that role. But so we gotta work together to build those assets in our community. And I can see the collective work in our communities in supporting our health systems with tools that we have, and we can work together to make it better. I think we have all the tools to get there. I can see, when you have someone in extension that can, relate to the community, that's very important. As Dusty said, if the information is coming from the community, it will go faster. So those videos that have been, part of the community, they have more views than any other video. So I just want to share how important it is to have the community, be involved in building that leadership. Thank you.
Yeah, thank you, Beatriz. Basically, I'm also like on board with Beatriz's vision as well. I really would like to see some form of emergency communication system for reaching Spanish speakers and mom speakers, but, you know, not limiting just to that. If it works for Spanish and mom speaking communities, maybe we can build even on other languages, Arabic, Russian, other very common languages in Oregon. So building that, you know, not just primarily English communications and expanding it, you know, through our extension services. And as Beatriz said, we have the tools, we have the members already established in those communities that could help us implement this sort of communication system. But not only that, but also building leadership among Latinos and Indigenous community members, you know, to be able to have them lead these efforts and not just, you know, us coming from other organizations. It's actually on the ground community members that are taking the lead.
What I'll add to what Beatriz and Oralia already shared is from the perspective of our history in extension in Oregon, we have had many strong programs over the last 100+ years supporting rural communities across the state in areas of agriculture and in health from the perspective of reducing nutrient deficiencies and teaching about how to avoid foodborne illness. We have a really strong youth development program. We have strong forestry programs. And then our family community health program brings expertise in building healthy communities. And so I think about how we move forward for the future for healthy Latino and Indigenous communities. That means bringing resources from Oregon State University in a number of ways. Our regions on the coast and in other rural places across the state are resource poor. We really need a lot of help in these regions. And whether we can bring that through grant funding to do programs or helping do education about evidence-based approaches to build healthy communities, or doing applied research like the needs assessment we're doing now to be able to help bring to light some of the issues and the interventions that are needed to be able to assist the communities to be able to build strong communities. And be able to, I just want to say how much I agree with Beatriz and Oralia's view about building leadership within the community so we can be a support, but help them build the communities that are going to be strong and resilient for whatever comes next.
Thank you all so much. It sounds like we're building new leaders and building a culture of belonging, a culture of inclusivity, building true community. Thanks so much. I want to at least wrap with one question from the crowd, and that is, how do you even get started with this work? I think, you know, times are hard. There's a lot going on. People have a lot going on. What do we do first? How do we organize? How do we get a small group together to start big change?
For me, it started with a phone call. It started with calling Beatriz and saying, where can I help? And her telling me what I needed to do. And just thinking about what tools, resources, skills do I bring to this? Yeah. And then invite as many people as I could. I think that if you bring together people who are passionate and want to help, that's where it begins. I think also starting with a small project where you can build a team and have a win and figure out more about what the community needs and then think bigger. But that's where it started for me.
Any other tips on how to get started?
Yes, I can share that. You know, I can say, you know, when Dusty called me, you know, I share everything. Since that moment, I started building the relationship with Dusty, you know, and, you know, I knew that Dusty had you know, they had experience in building collective coalitions and in the community. I knew that. So as soon as start sharing with her, you know, right away, you know, that was the one step. And it's having the contact of people that is gonna be supporting and who are the decision makers. Also having that, you know, as your relationship building with them, like the commissioner having her, you know, and also sharing what is happening in the community openly and say, you know, we need help. I think as an immigrant, I can say that's very important that we ask for help, and the more we ask for help, I know there is passionate people in our community, like Dusty, the commissioner, all the Samaritan, you know, director, and the director from the health department, and all the people that has been participating in Oralia too. You know, they are there to support us, and I think that's a big step. Asking for help and building relationships is very important, and also identifying in the communities who are already the leaders, you know, like at the church. We have people who has been sharing information in Facebook through our leaders in our community. So those are very, very important steps to get there.
Yeah.
Yeah.
Really?
I'd just like to add that, you know, accepting invitations, and for me, it was like, well, what can I do? You know, I'm way out here in the Valley. How can I support this? And just, you know, being invited and participating and saying, yeah, I do have strengths in this language, and I can help with translation, and I can help with interpreting, starting with, like Jesse said, smaller projects, and then it kind of just grows from there.
It means so much. I think these are really important lessons. And, you know, for folks who, you know, we don't want to be a burden, we don't want to ask for help. At the same time, we want to make change. You know, how do we do this? We want to be together more than ever. It shows you sort of the power of connection, the power of understanding community needs, of, you know, striving together as collaborative partners. So if folks want to know more, and if they want to connect with you all, do we have a public facing in media presence? Not yet. So we'll have folks get in touch. You can look up Beatriz Botello, Dusty Linnell, and Aurelia Mendez. You can look us up in the Oregon State faculty pages. And I know as I'm about to turn it over to Casey Farm, I know Casey sends emails to all of you who were registered and who attended today. And so there'll be a way to find us if you'd like to get involved. We're so thankful to our audience for listening, to our panelists. Thank you so much for taking the time and energy to share your story. And special thanks to our hosts for having us today. Over to you, Casey.
Thanks, Allison, and thank you to our audience for their participation and for our panel today. Thank you for your time, your work, and your passion. It's wonderful to see a very community focus center between, and the collaboration between OSU Extension, the college, the university, and, you know, in this case, the community of Newport and Lincoln County. So a really wonderful talk today. Thank you very much.